Thank you so much for that nice introduction. Thank you for inviting me tonight. I decided to wing it without not wing it really, but without a PowerPoint, which I'm pretty dependent on. So we'll see how I do. This is also my first time talking with my real face in front of real people in a while. I've talked with people by Zoom a lot in the last couple of years, but not in person. So thanks again for inviting me tonight. So I'm going to talk about children's mental health. I realize that I have my perspective from my work and my life. I can't claim to know everything there is to know about all the mental health needs of children in the world, country, state, or county, but I will try and do my best to tell you what I know. So I don't think I really need to tell you whether or not there is a mental health crisis among children or anybody. The answer is yes. I was looking up some data, I was looking up some studies, I was going to share all these little tidbits, and then I realized that they were all kind of, everything I was looking up was combined in this one Surgeon General's report. Last year in the fall, many mental health experts and pediatric health experts got together and declared a national emergency in child and adolescent mental health. And so the Surgeon General proclaimed it as an emergency. So a little bit of background so you know how things were going before the pandemic. Before COVID-19, mental health challenges were already the leading cause of disability and poor life outcomes in young people. And up to 1 in 5 children from the ages of 3 to 17 in the U.S. were reported to have a mental, emotional, developmental, or behavioral disorder. And then additionally, from 2009 to 2019, in just one decade before the pandemic, the share of high school students who reported persistent feelings of sadness or hopelessness increased by 40% in one decade. So that the statistic was more than 1 in 3 students. It just blew my mind to read that. I have a high schooler myself, and there have been several mental health sad events in the last few months. Sorry, I wasn't going to say that because I knew I would get choked up. Suicidal behaviors among high school students also increased during that decade before the pandemic, with 19% of students considering a suicide attempt, and that was a 36% increase from 2009 to 2019, with 16% of those kids having made a plan in the prior year. That was a 44% increase in that decade. And between 2007 and 2018, suicide rates among youth ages 10 to 24, so also young adults, increased by 57% in the U.S. Early estimates based on this national health study also were showing more than 6,600 suicide deaths among that age group in 2020. We know all the data are not in yet about the effects of the pandemic and all of that. So now, in our pandemic or post-pandemic world, the pandemic added to the pre-existing challenges that the youth were facing in terms of their mental health. It disrupted the lives of children, and things like in-person schooling and in-person social opportunities like this, and access to mental health care and social services. There are many school-based mental health programs in the U.S. now, as well as food and housing and the health of their caregivers. And of course, childcare, you just heard about that for the last 20 minutes as well. And then the racial reckoning is another thing that has made an impact in students and their mental health. The pandemic most heavily affected those who were vulnerable to begin with, such as youth with disabilities, racial and ethnic minorities, the LGBTQ+ youth, low-income youth, people in rural areas, youth in immigrant households, youth involved with child welfare or the juvenile justice systems, and youth with housing insecurity. So things were already getting worse before the pandemic, and in the last 2 years, we know people's mental health has worsened. The access to services hasn't been able to keep up with the demand, and the support systems that were supposed to be functioning around our youth have become overwhelmed. And as I said, we're still trying to collect data on the fallout. I think we'll be hearing about it for years to come. We read about this in the news every day, so I don't need to belabor the point. I will say that in the Surgeon General's report, there were a couple of recommendations that I thought might be relevant for you all to consider. There were a bunch of other things, but the two that I thought were relevant most for this group would be the recommendation to ensure that every child has access to high quality, affordable, and culturally competent mental health care, and the recommendation to support the mental health of children and youth in educational, community, and child care settings, and expand and support the early childhood and education workforce. So as far as, like, if you're wondering how many people among our children and adolescent population receive mental health services, a national health survey is conducted every year in the U.S., and the data that I saw in the most recent article about that said that among children and adolescents ages 3 to 17, about 10% had received mental health services, and about 8% had taken medications for mental health conditions in the past year, based on their parents' report. Way back in 2012, a group from the American Academy of Child and Adolescent Psychiatry published a study that showed that only 20% of children who needed mental health services got them. So that was before the pandemic. I looked at some Iowa data as well. There are also some national organizations that publish data. It's called Mental Health America. It breaks it down by state. Iowa is 22nd nationally in terms of mental health services and access, where 1 is good and 50 is bad. It's 22nd, so kind of in the middle of the pack in terms of meeting the needs of youth with mental health needs. But if you break it down a little bit and look at, for example, statistics of youth with depression, we know that nationally about 60% of youth with major depression don't receive any mental health treatment. And even in states that have really great access to mental health treatment, 1 in 3 still aren't getting the mental health services they need. Iowa is 14th on that list, so we're in the top third or so. However, we're 27th in terms of the ability to provide consistent mental health services. So we may do a little bit, but not enough. And then the statistic, a couple more that made me sadder. Funding is an issue, right? Even though mental health parity laws were enacted in 2008, saying insurances need to pay for mental health benefits, same way that they pay for physical health benefits. Even though those laws were enacted, in 2017, a behavioral health visit for a child in Iowa was over 10 times more likely to be considered out of network for insurance than a primary care office visit was. And this was over 2 times the disparity for adults, when you look at mental health parity. Iowa is 29th on the list of funding and being able to cover well the mental health costs for services. And the rate of mental health providers has improved. It's increased in nearly every state since last year, but the need for mental health care is going to greatly outpace the additions to the workforce, especially as rates of depression and anxiety and other mental health disorders increase in response to the pandemic and increased awareness of ongoing racial injustice. Iowa is 45th on the list of having the mental health providers that we need for the needs of this state. 45th, that blew my mind. So I was also asked to just mention a few things about the mental health service delivery landscape when I got up this morning and thought about coming here tonight, I thought about, it feels like I'm on Shark Tank, right? You guys are the shark. Except that I don't have something specific that I'm selling, right? I don't have one thing that I'm really hoping you're going to land on. I'm very excited that you all have decided that children's mental health is of interest and you're going to bring your influence and your financial clout to some good cause. I think that's wonderful. And I didn't know about this group, and I think it's really neat. And I hope that maybe someday I will be able to join. So what does the mental health service delivery landscape include? There's something you've probably been reading about in the news since maybe last summer. There's the new Iowa Center for School Mental Health. They got $20 million. They're still working on what exactly they're going to do, but I'm very hopeful that that will help, because we know from the research that mental health services delivered within the schools can be very impactful because they're right there. And there's a better rate of utilization and easier access for families who aren't as able to get to clinics and things like that. There's also, like locally, I keep hearing recently about the I'm Glad You Stayed project, focusing on suicide prevention. And then there's the mobile crisis services and free clinics in town. Johnson County Social Services provides comprehensive resource directories of what's available. There's United Action for Youth. I think you do an especially good job with our LGBTQ kids. Thank you. Okay, there's 4 O's. They have a network of programs to support children and families. There's Child Serve. I've been impressed that Child Serve has increased the number of providers that they have. They've increased their building space. They've added space in Coralville. Many of these agencies that I'm talking about do take Medicaid, and that's an area where I see the greatest need. People with private insurance need help too, but I see kids who are uninsured or have Medicaid as being a great area of need. Iowa City Compassion provides community services to support immigrant families. It's really neat. If you don't know about it, learn about it. They're pretty cool. The Abbey Center is a mental health center locally that provides both medication and therapy and other services. And the University of Iowa, there are a lot of us there who provide services. We take Medicaid, we do medication, therapy, assessment. So I don't know if you want me to throw out a few ideas that I had for what 5224 Good might consider, but I'm prepared to do that if you're interested, or if you'd rather have me just go on and start answering questions, I'm happy to do that. Here are a few ideas, okay. And before I showed up tonight, I didn't know how big this group was. I knew how much each chip in, so I thought, when I saw this room, I went, whoa, that could be a lot. You could make a really big impact. That's really, really neat. So as far as what you should do, of course, there's so many possibilities. Your job is going to be hard. You're going to need to figure out an area of focus and kind of the level of impact that you want to go for. I think that, in my opinion, the areas that you might want to think about focusing on could include some of those most vulnerable populations, families who don't have as much income, people with disabilities, immigrant families, rural populations, which are right around here, LGBTQ populations, and anybody who might be underinsured or uninsured. But that there are other people who need help too, people with bereavement and loss related to suicide or pandemic deaths. That also came into my mind. I think there's a lot of need there. I think one thing that's really needed would be to improve the access to not just any mental health services, but high quality and evidence-based mental health services. There are a lot of providers out there. I see kids from all over the state, and I manage the therapy wait list in child psychiatry. So I see how many kids are coming through every day and every year. And I see that there are kids coming to us for specialty care that they can't get anywhere else. You know, you can't always find someone who knows how to work with OCD or habit reversal for a tic disorder or something like that. But there are also people coming to us from hours and hours away because they can't find anybody who just can provide high quality basic mental health care, you know, things that I at least consider basic, like, you know, some parent management training or some cognitive behavioral therapy or some, like, for early childhood, PCIT is something that our people in our department have worked hard to make more available, but there's still more need for that. So there are lots of, I'm throwing around a lot of terms that may not be familiar to everybody, but improving access to things that are not easily accessed for our populations who are uninsured or underinsured, or everybody in general, actually. I don't know, I also thought service availability in rural areas, even right around here, and even an hour away, like, you know, Muscatine, Minnetonka, are a couple towns that come to my mind because we see a lot of kids from there. Or finding more people who can provide bilingual services. So, you know, helping provide some training or education for more people in those areas. There are definitely opportunities to fund things like postdoctoral fellowship to train somebody, but, you know, that would be more like just one person or a few trainees if you got a few like social work trainees or one PhD trainee, something like that. Training for mental health services that can be delivered in an integrated primary care setting would have a huge impact. Those folks can reach people and maybe have more of a preventative effect because they can help be part of screening and services earlier on before you need to send your kid to the Department of Psychiatry at the University of Iowa. In the introduction, one of my favorite organizations was mentioned. It's called Lives in the Balance, and its founder developed an approach called collaborative and proactive solutions. You might read about it. It's happening in more places around the world and around the U.S., but not much in Iowa yet. And so that's something I'm super interested in, and they're starting an initiative for doing collaborative and proactive solutions with like preschool-age children, which I think is really, really cool. They're all about prevention. So that's